Have you ever been at a family dinner or out at a restaurant and witnessed someone choking on a piece of food? Worse than that, have you ever seen a young child choking on a toy that they put in their mouth? According to the United States National Safety Council, choking is the fourth leading cause of unintentional injury death in the United States, the first leading cause of death in infants, and the fourth leading cause of death in preschool-aged children. In 2018, there were 5,084 choking deaths in the United States. Most in older people, 56% of those who died in 2018 were over 74 years old. Most common things children choke on are food, like grapes, hot dogs, candies, and gum, coins, balloons, and other toys. I have never witnessed anyone choking, but I was raised in a home of medical professionals. I have been taught basic CPR, which includes the Heimlich maneuver. I have heard numerous tragic stories from my mom, who worked in the emergency room, and my stepfather, who was a firefighter paramedic. Since anyone could find themselves in the middle of a choking scenario, you could be choking yourself. Most of us have elderly relatives, some of us have infants and young children now. All of us occasionally dine out. It is so beneficial to learn a simple Heimlich maneuver so you can act quickly, avoid panic, and possibly save a life. First, you need to recognize what choking is. It is when objects like food or small toys get caught in the throat and block a person's airway, making it difficult or even impossible to breathe. Lack of oxygen to the brain for more than 4 minutes may cause brain damage or death. There is a universal sign for choking: one or both hands clutching the neck. Otherwise, you can ask the person if they are choking and let them know that you are going to help them. If they can continue to cough forcefully on their own, let them. Other choking signs can be inability to talk or cry, difficulty breathing, or squeaky sounds when they try to breathe, and skin, lips, or nails may turn blue. You can help someone who is choking by doing the Heimlich maneuver, a simple procedure for dislodging objects or food stuck in the throat. The method was developed in 1974 by surgeon Henry Heimlich, and he designed it to be used by the general public. He recognized that the quick upward abdominal thrust lifted up a person's diaphragm and forced air into the lungs, creating a fake cough. The cough lets air move through the windpipe and push the food out of the airway and the mouth. This should only be done as a person is conscious and is recommended by the American Heart Association when a person can't talk, laugh, or cry. Also, don't perform abdominal thrusts on a child younger than 1 year old. Now for the procedure itself. First, you're going to let the person who is choking know you're going to help them. If anyone else is around, have them call 911. Okay, so if you stand behind the person, 1 foot in front of the other for balance. If it is a child, you may have to kneel down. You're going to wrap your arms around their waist and lean them slightly forward. You're going to make a fist with one hand and place it slightly under the ribs, right above the belly button. You're going to grasp your fist with the other hand and press hard into their abdomen. You're going to push inward and upward 6 to 10 times until the blockage is dislodged. If the person becomes unconscious, you may have to do CPR or call 911 if not done so already. If you are alone and choking, call 911. Perform the procedure on yourself with the same fist placement, pushing in and up. You can also thrust your abdomen against the hard edge of a table or counter or the back of a chair. If you have to do the procedure on a child younger than 1, first have someone call 911. Sit and hold the child face down on your forearm, resting it on your thigh. Give 5 back blows with heel of your hand, but keep your fingers up. If the object doesn't dislodge, turn your child over, facing upward, with the head lower than the body. With 2 fingers, do 5 quick compressions in the center of chest on the breastbone. Repeat back blows and compressions until the object is expelled. According to the American Heart Association, 70 to 86% of choking victims recovered after receiving the Heimlich. Remember to act quickly because brain damage can occur if body doesn't have air for more than 4 minutes. Where can you learn it? Check websites like the American Red Cross, American Heart Association, local fire departments, and even PBSC. Some majors and certificate programs offer CPR as part of the curriculum.